Hey guys, how are you people doing? So my name is Gaurav Mudgal, and recently if you have seen my videos, you might be knowing that I have matched into internal medicine residency in America. I'm an international medical graduate who was doing his USMLE journey, and finally I have matched. So a lot of people have asked me about a very important question, that is like residency match and how they can get clinical experience. So they have asked me this question, like how to do rotations in America. So let me tell you about rotation. So what is rotation? Rotation means like if you are coming to America, you need to have a certain kind of clinical experience in American healthcare system. Even like American medical graduates, they also have this experience. Their medical school consists of 4 years. That means 2 years preclinical, in which they study preclinical subjects like pathology, microbiology, pharmacology, everything. And after 2 years, they have like 2 more years of clinical training. That means they have to do core rotation that consists of like they have to rotate in every clinical department, and also in 4th year they have to rotate in they have to do away rotation. That means like they have to go to different hospitals, or like or the program in which they are really interested to learn about the basic intricacies of healthcare system. And from there they can get clinical exposure and also a letter of recommendation that they can put in their CV before application for residency. So for international people, international medical graduates, it's a very important aspect of application in which they can show the program directors about their clinical acumen and knowledge by rotating and getting knowledge of American healthcare system. So the question arises, why do we need rotations? So rotations are basically your way to learn about your specialty in which you are interested, or if you want to apply into that residency, you need to have certain kind of clinical experience in that specialty. First thing is your interest. Second thing is that you get to know about basic working of the hospital and the basic working of that specialty. Third thing, you get to learn from the people who are presently in that area of medicine, and they can also see you also learn from them, and you can also show your clinical acumen to them. And fourth thing is that you also get letter of recommendation from them. They'll write about you and your work ethics, and you also kind of make connection with the hospital and the residents and the healthcare staff. And if the hospital also has a residency program, then your connection can develop into something that they can also like give you an interview for residency, and they can also take you into their residency program. And also you can also become a part of research team. If they are like doing some kind of research, you can also involve in that research and make connections. Next question arises about the types of rotation. So types of rotation means like different types of clinical experiences are. First one is sub-internship or elective. So all those people who have not completed their medical education or like who are not graduate, they can do electives. And people who are also like international medical graduates or international students who haven't graduated, they can apply for sub-internship positions in different hospitals, and they can get full hands-on experience. So first one is sub-internship and electives. The second one is externship. Externships are also like similar to sub-internship, but these are for graduates. So international medical graduates who have completed their medical school, they can apply for externships, in which they give like a lot of freedom to touch patient, do physical examination and take history, formulate plan, and become the part of a team who is taking care of that patient. Third one is observership. Observership is basically you rotate in a clinic or hospital in which you'll be observing the doctor. The doctor who is treating the patient, you'll be observing that doctor. And fourth one is tele-rotation. That has actually arisen in recent time because of COVID. Not a lot of hospitals are giving inpatient hands-on clinical experience. So a lot of times you get like experience by like being a part of team through a Zoom call or something, and you actually get to know about healthcare system and patient care by virtually involving in patient care. If you compare rotation on the basis of experience, clinical hands-on experience, sub-internship and electives holds the highest position. Then comes externships, then comes observership, and then comes tele-rotations. So a lot of times your preference should be doing a sub-internship or elective. If you cannot get, then if you're a graduate, you can apply for externship. But observership and tele-rotations, they don't hold that much importance. So I would not recommend, but I would really like you to do sub-internship or externship. That is actually like a very good way of learning about American healthcare system. The basis of setting rotation can be hospital-based and clinic-based. So hospital-based rotations are basically you have to become a part of hospital care team in which you'll be doing whole patient care. And in clinic-based rotation, you'll be rotating at a clinic in which like you'll be joining a doctor who is taking care of patients who are coming to their clinics and becoming a part of doctor's team. So the difference between hospital based rotation and clinic based rotation is a very stark. In hospital based rotation, first you'll become a part of team. That means you'll be working with doctors and residents and nursing staff and other ancillary staff to take care of a patient in an extensive way. The second thing you can get is like a lot of times you get to work with different departments. Like if you are rotating in internal medicine department, you will also be working with emergency department, ICU care, and surgical department, orthopedic doctors, anesthesiology, everyone. So in the hospital setting, you'll be getting a wholesome experience. But in clinic base, you'll be only working with a doctor who is specialized in a particular branch, maybe internal medicine, orthopedic, or surgery, or some other. So you'll be getting to treat patients of a particular specialty, means like nephrology or internal medicine, like chronic condition. And you won't learn about like emergent conditions, like and people who are really sick and people who are in ICU or people of different specialty. In hospital, you'll also work with residents, so that means you become a part of team, and also you'll be treating patients and formulating plans, formulating differential diagnosis. You can also present case, and you can do physical examination. You are allowed to touch patient under the supervision of doctor. So, and you can also like access EMR system. You can get to know about patient's history and patient previous condition and present like how we are formulating treatment plan and everything. But in clinic based rotation, you won't be getting that freedom, because you won't be working under residents and attendings and multiple teams. So that means your experience is pretty much limited, although they do allow certain kind of physical examination, but I'm not pretty much sure about it. And the thing that like your experience at clinic is not that wholesome. Hospital based rotations are pretty hard to find, and you have to write a lot of emails to program like hospitals and attendings and like clinical coordinator to get these kind of rotation. But clinic based rotations are basically you can get through agencies, or you can directly contact doctors and clinic, and it is easy to get. Hospital based rotation give you a very strong LORs, letter of recommendation. So if you are working in a hospital, you will be working under an attending, and he or she will be able to assess your clinical acumen. Your attending will be able to judge your clinical acumen on the basis of your performance in the hospital setting, because in your residency you will be working in a hospital, not in a clinic. So your acumen will be judged on your work ethics in hospital. But in clinic base, you can actually get a letter of recommendation, but that won't be that strong. In clinic based rotation, you won't be able to become a part of a team, and you'll be only seeing a patient for particular disease, and you'll be only prescribing treatments. So you won't be able to get a strong letter of recommendation first. Second, you won't be able to work under a team, and like wholesome experience won't be there. Also, it won't give you full picture of American healthcare system. Now the question arises, like how can we get different kind of rotations? So if you are not graduate, you can apply for sub-internship or electives. And basically, if you want to apply for that, you have to approach different hospitals, and you can actually approach their clinical coordinators, or hospital website has a lot of people who take students for clinical experience or a sub-internship, you can directly approach them. And the second thing is vSlow. So vSlow is a website which is basically designed for American medical students who wants to do away rotation or who wants to get clinical experiences in different hospitals. So you actually get a lot of you get a list of different hospitals and their vacancies for students. So you can apply through that, and you can also call clinical coordinators in those hospitals. You can also contact your seniors if they have rotated at that hospital. You can also get connected with them, and they can also guide you through the process. Another way is like you can also email or contact attendings at that hospital and get the position. Clinic-based rotation, all you can do is like you can contact the doctor or his office about your willingness to start rotation over there, and they can like guide you through. And second thing is the agencies. A lot of agencies offer clinic-based rotation. You can also get from them. And the third thing is that like you can also ask if any senior or any contact who has done his rotation or her rotation over there, they can guide you through the process. Hospital-based rotations are pretty expensive. Sometimes you have to pay a lot of money. That's a kind of problem. But clinic-based rotations are pretty easy and cheap to get. A lot of agencies provide observership and tele-rotation. So for that, you have to contact them and enroll. So what are the things that are required before starting a rotation? So first thing is basically confirmation from the hospital or clinic or agency that your rotation has been scheduled. And the second thing is a valid visa. So you require a valid visa. You can come on B1, B2 visa or F1 visa, or if you are a green card holder or you are citizen of America, you can come on that. So valid visa, your confirmation. Third thing is your vaccination status. So you need to have certain vaccines. They are mandatory in America. So like you have to have like PPD test or IGRA test, MMR, measles, mumps and rubella vaccines or their titers, and Hep B, hepatitis B, and certain other conditions for which you need to have like vaccination. And you also need to have HIPAA certification and infection control certification, because these two are basic requirements before starting any rotation. Before starting rotation, you also need to know about three things. First is how to present a case. It is a must. Actually, that's a must requirement. So you need to know like how to present a case. Second thing is that like how to do physical examination and everything related to patient care. Third thing is that you are HIPAA compliant and you know about HIPAA rules and other stuff. So these are the three requirements that you need to know. For housing, when you are rotating at a particular hospital or clinic, you can actually book your housing through Airbnb. Second is like you can also book through a lot of agencies are there. The apartment.com is there, and what else? Like you can also ask agencies to find accommodation for you. Or if you're doing at hospital generally have their accommodation dorms or something. You can also ask clinical coordinators at that hospital to guide you through the housing process. This was all about rotation, and I hope I actually gave you a brief picture about like how to get into rotations and what are requirements and everything. Don't hesitate to contact me. I'll be writing my email address. You can send me an email, or you can also comment and I'll actually answer your question. Thank you very much and have a nice day, and just believe in yourself, and you are on a very, very special journey. I hope God help you. See you in next video.